Hello, today we will be talking about emergency contraception, where you take morning after pill to prevent unwanted pregnancy. And this video is in response to the several questions I get about Postinor, which is an example of an emergency contraceptive pill. And the questions like, is it safe? Is it dangerous? Does it cause barrenness or infertility? Does it work? Is it effective? If it works, how effective is it? In this video, we will be answering all of your questions relating to these and more. It is important to note that even though we will be mentioning Postinor a lot in this video, these words can also be applied with other products for emergency contraception that are similar to Postinor and containing levonorgestrel. First, Postinor is not an abortion drug. It is a contraception drug, and there is a big difference between contraception and abortion. Abortion means pregnancy has occurred and the baby is removed, while contraception is to prevent pregnancy from occurring in the first place. Postinor is for pregnancy prevention and not for pregnancy termination. If you are pregnant, Postinor will not work. It won't remove the baby, it won't affect the pregnancy. Number two, Postinor must be taken as early as possible. The key to making sure emergency contraception works as best as it should is this: the earlier the better. The earlier you take the drug after sexual intercourse, the better the chances of preventing pregnancy. Usually after 72 hours, that's 3 days after sex, there is no guarantee that Postinor will work. If taken early enough and within 72 hours, Postinor prevents pregnancy up to 85% of times, and that is high. There is, however, no way to know if the Postinor has eventually worked and prevented you from getting pregnant. Unfortunately, you might have to wait for your next period. If it comes, it has worked, or you have to give sufficient time to test for pregnancy. Number three, there is a wrong way of taking Postinor. This is the right way. If it has one tablet in the pack, simply take that single tablet immediately after sex and within 72 hours after sex. If it has two tablets in the pack, don't take the two tablets at once. It may work if you take it that way, but effectiveness is no longer guaranteed because you did not follow the manufacturer's instructions. Definitely, it will reduce the effectiveness. Rather, take one of the two tablets immediately and take the second tablet 12 hours later after taking the first. I hope that's clear. But most importantly, because different companies have different instructions, follow the instructions written on the pack religiously and to the letter. Also, always check the expiry date on the pack before taking Postinor. Number four, Postinor does not cause infertility. It does not affect future pregnancy in any way. It doesn't cause barrenness. In fact, few days after you stop taking Postinor, you can get pregnant immediately. And that is taken for granted that the couple doesn't have any fertility issues. If you are having difficulty conceiving, don't attribute it to Postinor. Most likely it is not the cause of the infertility or subfertility or difficulty taking in. You and your partner should see a gynecologist physically for checkup. Number five, Postinor is for emergencies. It is not a regular contraceptive. It is an emergency contraceptive, meaning it is reserved for only emergency situations. Postinor should not be taken more than once in a month in a menstrual cycle. Ideally, you should not take Postinor more than once in a month. In other words, it is for emergency. That's for unprepared, unprotected sexual intercourse, for burst condoms, for rape cases, and failure in other birth control methods, and so on. People who have sex regularly should look for other methods of contraception so they avoid taking Postinor more than once in a monthly cycle. You can, of course, take it more than once in a month or in a menstrual cycle. It won't cause any serious health or fertility problems, but it is just not advisable to take it more than once in a month or in a menstrual cycle. Number six, Postinor has side effects, Every drug has side effects, and that's not the problem. It is not an issue most times. Postinor is also not an exception in this. The side effects of Postinor are usually very mild, sometimes so mild you might not even notice them. If you see them and they are not serious, don't worry about them. Ignore the side effects. Some of the common side effects of Postinor include abdominal or stomach pain, vomiting, diarrhea, dizziness, headache, pain in the breast, and so on. In fact, some of the symptoms mimic the symptoms of pregnancy, and some ladies get to confuse those mild side effects with symptoms of pregnancy. You shouldn't. Also, taking Postinor frequently could cause more serious menstrual changes like menses coming too early or too late, heavy menstrual flow or scanty flow, menses coming too frequent than usual, severe menstrual pain. Now, it is important to note that if you are experiencing any of the above symptoms and they are severe and you are worried, you may want to talk with your doctor. Number 7, Postinor may be dangerous for some people. Taking Postinor in some situations may be dangerous, and some of the situations when taking Postinor might be dangerous include if you have diabetes, heart disease, liver disease, breast cancer or stroke, and so on. If you are breastfeeding, it's not advisable you take Postinor. If you are taking drugs for TB, HIV, epilepsy, and so on, in some of these cases taking Postinor might be dangerous. And in some countries, emergency contraceptive pills are considered OTC, over-the-counter drugs, and that means you can get access to these drugs without any prescription from a medical doctor or a pharmacist. However, I advise that you still talk with your doctor if you will be taking some of these drugs, so that we could double check and make sure everything is all right. Did you learn anything new today? Don't forget to hit the like button and stay subscribed. Take charge of your health and happiness.